have a clear picture of the impact of the COVID-19 pandemic on the death rate in South Africa yet. You'd remember last month, the Medical Research Council says the death rate may in fact be higher than reported when measured against the average number of mortality cases from the last couple of years. How close are we to the truth? Professor Debbie Bradshaw of the SAMRC's Burden of Disease Unit joins us now. Professor Debbie, good evening and thank you so much for your time tonight. Firstly, let's just get into what we know right now about these figures. We've had talk about people saying there hasn't been any influenza this year. I want you to draw also on that, if any of the deaths that we're seeing are linked to influenza at all.
Good evening to you and your viewers. In terms of updating the trends that we've seen in the total number of deaths in South Africa, which sort of shot up during June and July and became well above what would have been expected compared to previous years. We saw in the middle of July actually peaked and started to come downwards. They're still very much higher than what would be expected. And the challenge that we have got is that we don't know the actual cause of the death. We just know the total number from natural causes. What we can see, though, is that the correspondence of the increase that was seen province by province is very similar to the COVID epidemic, and as it's hit the different provinces, so the excess deaths have tracked a similar pattern. You mentioned that influenza this year, our national surveillance system in public sector and private sector has shown that there's really been hardly any flu this year. The stopping people from traveling and the lockdown really seems to have kept it at bay this year.
I'm keen to know, at which point are scientists and professionals like yourself going to make a decision about how to make sense of those mortality rate numbers? And because I would imagine that for the purposes of history, it's important to have that somewhere in the record. But what are the things that you're going to be looking at? And when do you say we are going to attribute this much number of excess deaths as being estimated to be because of COVID-19 or not?
We unfortunately we don't have as much data as we would like, and the minister has insisted that all the deaths that occur from natural causes suddenly or at home need to have a COVID test taken. That's going to contribute some information, but I do think it's going to be logistically a bit challenging to implement. And there's a second set of data that I really feel the scientists need to have access to, as particularly the Department of Health needs to have access to, is what the doctors have recorded as the medical cause of death on the death notification forms. It's legally required in the country that every death gets certified by a doctor, and they would put their best information around the medical cause of death. The problem that we've got is that it's going to take some time for that to be processed and become available to the government and researchers to analyze. So it's a piece of information that's really important to understand the extent of the epidemic.
Are you confident about the availability of that data, especially when we look at provinces like the Eastern Cape that have struggled with aggregating some of those deaths? We don't really know what really the problems behind the scenes have been, and so such a process, do those files even exist, I suppose, is part of the question I'm asking.
I think we're in the territory of trying to make sense from a lot of imperfect data, and it is going to need putting together the bits and pieces that we've got and triangulating and making sure that they hang together. There also is a methodology that we call a verbal autopsy, where we talk to the caregiver or family members who went through the last illness with the person who's died, and I think that's also a research method that might be helpful in this context.
Well, Professor Bradshaw, it sounds like it could be at least months, if not a year in the making, before we have a true picture then of what we've really been going through during this time.
I think we will not have the full picture exactly right, but I think that we are beginning to see trends and correlations in different data that can really help understand what's going on, if not knowing the perfect number.